Perfect.
Sounds good. I'm happy to kick it off. Thank you everybody for joining us. As you saw in the emails that today is about mastering digital workflow. Most of us here at Select love working digitally, including myself. I have two different scanners, a Meta and an iTero. Both have, in my opinion, some different advantages, but really complement an entire workflow of how to work digitally. We're honored to have Lexier, which is one of our lab partners. Not only are they our lab partner, but they also are really masters in digital dentistry. They not only help us out, help us scan and help with our workflow, but they're also doing a digital scanning program where if we're using them enough that we're giving us an iTero scanner. So we're really trying to use them for a lot of our digital workflow. I see many of you on here attendees that have different scanners, and so I'm super excited to welcome the Lexier team to give us a lecture tonight on basically working in digital workflow, whether it's new to you or whether you're using it and can find things that improve your day to day. So I will pass it off. Pass it off to Tori.
Awesome. Thank you, Dr. Mason. Welcome, everybody. Good evening. Thank you guys so much for joining us tonight. My name is Tori McCraw. I'm the Senior Manager of iOS Adoption here at Lexier Dental Lab Group. I've been with Lexier for about 3.5 years and been in dentistry for about 3.5 years. So I've really learned the technology, mastered it, and that is what I specialize in. So I am iTero certified as well as 3Shape, and I do have experience with other platforms as well. So tonight we're just really going to focus on just a general overview of digital dentistry in the marketplace and what it's doing for doctors and clinicians and their entire teams, but what it's also doing for patients, and then what it also does for the lab. So we'll take a deep dive into that. But before I get started, I do have some colleagues on here as well too, and so I do just want to give them the opportunity to introduce ourselves, and then we'll dive right into the presentation. Each of us will have a portion of speaking. So I can't see anybody but Dr. Mason, so I'm going to pass this off to Emily, and then maybe Erica, if you just want to introduce yourself quickly, and we'll dive in.
Thanks, Tori. Hi, everyone. My name is Emily Geisey. I have been with Lexier for about 3 years as well. I am a territory manager in the Northern Jersey area and Long Island, and also an iOS clinical specialist and help support offices with training and going digital. And before that, I was a hygienist, so I have some clinical background as well in office. I was a hygienist for a little over 5 years before that. Great to be here tonight, and I will pass it over to Erica.
Hi, my name is Erica Merrill. I'm Director of US for Corporate Accounts. So I've been working with Dr. Mason, Joe, Dr. Portnoff for quite some time now with Select and getting these things off the ground. And we're happy to be here in the form of education, as we find that that's so important. So we're excited to have Tori tonight and Emily presenting on the digital workflow. So thank you all for joining us, and we'll kick it off.
Awesome.
Erica, I just want to chime in with a couple little housekeeping items. My name is Alyssa Scarciati. I'm the head of our clinical education here for Lexier Dental Group. Just a couple quick things. If you guys have questions throughout the meeting, you can use the chat feature, and then Tori or Emily will be typing in a response, or if it makes more sense, they'll be addressing them at the end of the program. And then, just because I know it always comes up, CE certificates are being handled here through Lexier Dental Group and our partner at Care First Dental Institute down in Texas. And we'll be getting those over to you usually within a week. We're able to turn those over. So if you guys do have any questions, you can certainly reach out to me, but you can expect to see those via email in about a week. Thank you.
Fantastic. Thanks.
All right. Thank you, guys. Perfect. So hopefully everybody can see my screen. I'm going to walk you guys through the agenda just so you have an idea of what to expect throughout the presentation. So we're going to start off with digital technology at Lexier Dental Lab Group, just where we are on the forefront of technology and what that means at the lab level. Then we're going to dive into the iOS market size and growth, just so you guys can see what the market's doing and what the trends look like. Why digital dentistry? I think this one is important for everyone on here just to see, what digital dentistry does, like I said, for patient, yourself as a clinician, your staff, as well as the lab. And then we'll go into the digital workflow from office to lab. tips and tricks for best restorative results. Now, today we're only really going to focus, like I said, on more of the basic overview, but as we continue to partner with you guys, we are, going to look to do more workflow specific and iOS specific digital workflow support. So we'll dive into that. Then we'll finish up with some Lexir scan evaluation and then a Q&A. So starting off with the technology at Lexir, so we try to embrace the digital trends in the marketplace, from 3D printing to, excuse me, sorry, my screen is in my way. So from 3D printing to digital dentures, we all obviously have the industry standard design software. So we utilize 3Shape and exocad on the back end, and all of that is used for any of your procedure planning, surgical planning, all-on-X complex cases, crown and bridge designs, removables, and appliances. So this is what we're using on the back end. And we just also wanted to highlight that we do accept scans from all iOS platforms. I know a lot of what we're specifically speaking about is more tailored toward the iTero, but we do accept scans from all platforms. So the global scanner market size and growth, I found this article and I thought this was really interesting to share. The global intraoral scanner market size is estimated to grow by 915 million at a compounded annual growth rate of 11.68% between 2023 and 2028. I thought this was just pretty significant because, as you guys can see, the market's coming a long way and it's only continuing to grow. There's not going to be a slowdown. This is, an adoption phase. Everyone's adopting the technology. They're integrating into their offices, and we're only going to continue to see this grow. I thought it was great to highlight some points as to where Lexir stands today, just so everyone can get an idea of what that looks like and what we're doing here at the lab. So Lexir is at about 55% digital. So that means over half of our cases are coming in from a digital platform. And I wanted to break it down by the product category, just so you guys can see what our customers are scanning for currently. A lot of it's coming from the crown and bridge. Obviously a lot of implant scans, and then removable products. So super important. We obviously love to see our digital percent increase as well, and we are growing monthly. And just to highlight where a lot of the growth is going to come from. So this article talks about the global intraoral scanner market, but 42% of the growth will come from North America. So highlighting why digital dentistry, this is important. I like to break it down because, why is digital dentistry the fastest growing segment in the industry? And I think it's obvious because it's a win for patients, win for doctors, and win for the lab. Wins for the patients, I think, patient comfort obviously is a big one, and overall experience. We're finding that patients obviously want to go to a dentist that is digital. Once they've gone to a dentist that is digital, or if they, have a family member that has gone to a digital dentist, they want to find that technology, and they want, to go to a doctor that has that technology. So that's a big one. Patient education and patient engagement. I think those are the top two that are wins for your patient. But then moving on to the wins for you as the clinician or your staff. This is obviously going to reduce your chair time, increase case conversion, better treatment planning for ortho or restorations, reduce costs. So you're, not having to buy all the impression material. I mean, I still obviously think you got to have the impression material, but maybe not as much. And then this is obviously saving you money on the shipping cost as well. Then just better, faster communication with the lab and reduce lab remakes. Wins for the lab. So greater case acceptance, greater volumes. We can, we're not opening packages, opening traditional cases. It's coming in through a digital platform, right to the lab. We're pulling it out of portals, downloading files and putting them into design software. So just a faster production on our end as well. Reduce turnaround time. So this is huge for the lab as well as for, you as a clinician and your staff, reducing turnaround time by almost a day, if not more. Having a digital RX is great for the lab because, you know, we've all seen, we'll have RXs come in where sometimes we can't read the handwriting or things are left off. And so obviously it's just a lot better communication with the lab. Anytime I train an office on scanning any digital workflow or digital impression, I always give the advice of the more information you can give to the lab, the better. The more information you can tell us, the better the outcome of the restoration or, you know, product is going to be on your end. Then the next one, just decrease remakes, obviously with us, which equals a better partnership with you guys as the clinician and your staff, and then just lower turn and attrition. So understanding the digital workflow from office to lab, again, this is just kind of a generic overview of what happens from when that scan leaves your scanner to coming to the lab. Obviously, you're going to scan your patient for your specific procedure type. Once you've done all your scanning, you're going to use your iOS platform's tools or do any cleanup if necessary. Checking your occlusal clearance is always great when you're doing any, you know, restorations, crown or bridge. Making sure your margin's clear. If you can't see the margin, chances are we can't see the margin at the lab on our end. So just making sure you review it, clean up anything if necessary. Move on to step 3, in that case to the lab. If you are working with an iTero platform, we are direct to lab. So what that means is that some other labs do not have the partnership that they're direct to lab. They have to have their iTero scans go through Costa Rica, which is iTero's modeling center. That's where they do any sort of cleanup of the scan if necessary, and then they push it to the lab for fabrication. Well, we bypass that and your scan comes directly to our lab. So we have the ability to clean up anything on our end, you know, mark your margins, things like that, and then it's put into production shortly after. Step 4 is just going to be receiving any feedback from the lab if needed. So once we get that scan and we take a quick review of it to make sure, A, we have all the information to proceed with the case. B, you know, is anything missing on the scan? Is there any data missing? Can we see the margin? Is the margin clear? Which we'll look at a few scans here later on in the presentation, just so we can show you guys what we mean by, you know, missing data, margins clear, things like that. But let's just assume step 4, your scans are great. We go to step 5, which is just going right into production, obviously milled or printed, whatever the case type is, and then delivered to patient. And now I'm going to kick it over to Emily Geisey, and she's going to walk you guys through what all can we actually scan for.
Right. Thank you, Tori.
Absolutely.
All right. So what can we scan for? Let me minimize this here. Okay. So we can scan obviously for full arch, Invisalign, or whatever clear aligner system that you're using. Wellness scans, if you're not doing those are becoming very popular in offices for hygiene scans or new patient scans that you can educate the patient and have just a baseline for that patient, which is really great. And then appliances as well, obviously sports guards, retainers, night guards, you can scan for that as well. Single unit crowns, we can scan for partial dentures, scan bodies for implant scans. You know, you're going to utilize, instead of your traditional analogs, you're going to use your scan bodies if you'd like to scan. We can do bridge scans. We can do full denture scans, which this is in a picture of a full denture, which actually has a wash in it, and they scan the entire denture outside of the mouth. And you can also do this for, you know, if the patient needs a new denture, or if you're just doing a copy denture. This is a new, I wouldn't say newer system, but this up here is an ENCODE implant scan. So we are an ENCODE empowered lab. Some of you may or may not work with ZimV. They have their ENCODE scan body. So instead of it looking like that traditional scan body, you can also scan for ENCODE. And then we do a full roundhouse. You can scan for that as well. I would say once you're a little bit more proficient, if you're a beginner, you might not want to jump into a full roundhouse, but you can absolutely scan for this. That's this case here that we have the scan up. I actually work with this doctor and the case came out beautifully. And then you can also scan for surgical guides. and right here we have our latch guide. So, if you're doing all on X, we have like a stackable guide. So you can scan for pretty much everything, which is great.
Awesome. Thank you. You ready for me to go to the next slide?
Please, please. Sorry. Thanks.
No, you're good. Perfect. Let me make sure. Sometimes it gets stuck. All right. Perfect.
All right. And then we'll go over just a couple tips and tricks, going for, talking about crown preps and tips and tricks on how to really retract that tissue. So retraction method, packing 2-cord. I know it's some doctors do, some doctors don't, but definitely subgingival preps, packing 2 cords. In a picture here, we can see a single cord and a double cord. So the dual cord technique is definitely ideal. A lot of docs will leave one and pull one right before they're ready to scan, or using a hemostatic agent such as Traxident or Hemodent. You can use that as well. That just helps to control the bleeding so that you can see your margins and keep everything nice and clean. Prep style, I don't know if this is something that's always talked about, but obviously, depending on the restoration that you're doing, is gonna, you might adjust your prep style, but chamfer definitely is the way, we can see the margins better, shoulder, bevel. Some doctors do only like feather edge preps, which we can work with, but, and you'll see when we go into our scan quality pictures, you'll notice a difference between the prep styles and how well you can see or can't see the margin. So there's just some tips for retraction and preparation when you're scanning for a crown.
Perfect.
Go to the next one, Tori.
You want me to just put all of them on the screen?
Yes, please.
Let's
That's
just
fine.
do that. Okay, perfect.
Yeah, thanks. Okay, so tips and tricks for scanning and for restorative scans. Definitely have cotton rolls, 2x2 gauze, hemostatic agent like we talked about. If you use Traxident, air water syringe, suction while scanning. Sometimes, you have patients who are bleeding a lot. So you need to just air dry right up until you're about to ready to go scan that prep. So you have a really clean margin and we can see everything. Overhead light and your loop lights, make sure that they're turned off when you're scanning, because that will definitely cause too much reflection and you either won't be able to scan, or you might notice sometimes you'll scan and then it'll pull out what you just scanned because it thinks it shouldn't be there. Turning the wand off, definitely with iTero, only turn the wand off in between segments. So you want to try to scan the full arch and then turn the scanner off. If you're turning it on and off, you could have stitching issues, things like that.
Is it just me or?
Yeah, I think she might have some Wi-Fi issues, but I can take over.
It's not just, yep.
Sorry, did I cut out?
Yes, but it's okay. If it happens
I'm so
again,
sorry.
I'll just take over. It's totally fine.
Okay, I apologize. Where did I cut out? 12 o'clock position?
Yes.
Okay, so for positioning, I was just saying 12 o'clock position with the patient, laying the patient all the way back in supine positioning, except for when you're doing the bite. So when you do the bite, especially for restorations, you want to make sure you sit the patient up to at least a 45-degree angle, because when they are all the way back, as we know, it can relax their jaw too much, and then we're getting an improper bite. So that can really throw things off for your occlusion, for your restorations. Making sure, like we talked about, keeping the prep really clean, free of blood and saliva, making sure that the tissue doesn't collapse over the margin, and really just keeping everything dry. And even if you're doing full arch scanning, just take a 2x2, dry the arch, and then go into scan. Everything is angles. So sometimes when we see offices scanning, they're not, you might be scanning the occlusal or slightly on the lingual, and as you're going around, it might be capturing the lingual, but it's really not getting a good depiction. So think of a selfie. When you take a picture up here, you know, you're getting a different angle, and that's not really how I look in real life. So we want to make sure that you're getting very direct on the lingual, and really nice and flat on that buccal side as well. And then knowing your proper digital workflows, you know, dependent on what scanner that you're utilizing, what your lab prefers. And then there's different workflows, obviously, for crown and bridge versus implants, versus removables, dentures, partials, all of that. All right.
Awesome.
Sorry, thanks.
Thank you so much, Emily. So we do have a little short video for you guys, just so we can show the scan of a crown and just kind of incorporate this into today's or this evening's program today. I think I restarted it, guys. I'm so sorry.
In case there's anyone on who's listening who isn't already a scanner user, can you talk a little bit about what you're showing and what you're doing?
Oh, yes, I didn't realize, I don't know if anybody can hear the actual audio
Yeah.
over it. So I was going to stop and ask that. And
No, there was no, I thought there was supposed to be, that's why I wanted
Yeah.
to interrupt.
there is. Do you know, when you work on two screens, sometimes I guess it's only playing on my other screen. So let me just pause the audio and then I can certainly talk through that. So basically what we did was we started off with the prep scan. If you want me to back up, I can certainly do that and just talk everybody through the actual scan. That may just be better. That way we're not going to confuse anyone. So we're going to start this off with a scan of just the prep. This is on an iTero. So I'm lining up my green crosshairs because I want to get that centered before I start my scanner, and I want my scanner flat on the tooth. As Emily was talking about with the angles, you can see I go occlusal, I roll very lingual, and then I roll very buccal, and then I do mesial distal. I'm only focusing on my prep during this segment. I'm not worried about the contact data at this current time. This is an actual training I was doing, so I try to clip the videos and put them together, but there was a piece of data that I missed right there. It wasn't necessarily that contact area, but I wanted to make sure everything around the prep is there. I'm centering my green dot because this is important for the digital die. I move on to the prepped arch, which I don't know if you can see the cursor. I was trying to highlight that in this section, I'm really focusing on my contact data because this is where the lab will get your contact data for that tooth. That's why you don't get it in the first scan, because at the lab, we use this arch. We ditch this die right here. We do not use this prep. We use the first one that you scanned. We place it into this arch to make sure everything fits. That's why your contact data is extremely important in this arch scan. There, I missed a little bit of data, so I went back in, filled that in there to make sure everything was captured. Just checking to make sure, got contact, solid occlusal surface, moving on to the opposing arch. And here I'm just doing a quadrant because I'm only doing a single unit posterior tooth. But if I were doing anything multi-unit, anterior preps, things like that, I probably would do a full arch, but I'm only really concerned with a quadrant and making sure I have a solid occlusal surface on that opposing. Moving into the bite, if you have an iTero, it's really important that when you start your bite scan, you start the scanner and you hold for one banana, go up one tooth tissue, down one tooth tissue, and as you can see, it pops in pretty quickly. And that is all the crown scan steps that you would have to do on an iTero scanner. So we just wanted to show how quick it was. I didn't obviously do a video of your post-processing tools, but after this, I would go into post-processing and just make sure that I have everything cleaned up. I've got enough clearance with my prep. I don't need to go back and, physically adjust on the prep tooth or rescan. Everything looks good. I look at my margins in monochrome versus color, just so that I can really see if I can see my margin line all the way around, which will show you guys some scans where you can see monochrome versus color and you can see the difference. And then after that, I check and make sure my prep is, in its own section so we can ditch that die. And then I go from there. So that's basically a crown scan on an iTero.
Tori, we have a question.
Okay, thank you.
And there was another question I was going to answer at the end regarding scan bodies, but it disappeared. But we can just, if it's okay, we'll just answer right now since we're on this segment.
Perfect.
This question says, am I correct in understanding that you recommend keeping the scanner on even when evaluating if there is missing data and going back over the prep?
So once you've captured your occlusal lingual buccal, when you're on the prep, it's really important to not spend too much time on that prep. So you go in, do an occlusal, roll lingual, roll buccal, mesial distal, and then you want to come out of the mouth and cut the scanner off. Okay. iTero does have some tools and it's called a fill tool. You can go in and you can use that fill tool because the fill tool is only going to highlight the areas that you missed. And it's not going to add data to the areas that you've already captured. So it's important to not cut the scanner on and off during segments, but if you have to cut it on and off during segments, utilizing that fill tool or making sure that you go right back into an area that the scanner can recognize and don't spend too much time trying to capture the data. A lot of times I get questions from offices, or just, I see offices spend so much time scanning that prep. And at this point, you're working against the patient's environment. And so it's important that you really don't spend more than 8 to 10 seconds, because at that point, there's saliva, blood, all these things about the patient's environment on that prep tooth could be changing. So you just want to definitely make sure that whatever platform you're using, most of them do have like a fill tool or a lock tool or something like that, that you can get your first pass or get your first scan, cut the scanner off, analyze what you missed, go back in with the fill tool or a lock tool or something like that, that will allow you to then capture what you missed without adding more data.
That was a great question.
Yes.
And then I'll just, if it's okay, we'll just answer that other question. And I do apologize. I think it was Dr. Mason, it disappeared. But Dr. Mason, you interrupt me if I didn't, because I can't see it now. But so you were asking about Atlantis abutments for scan bodies. So
just about scan bodies and what, which one your labs use and things like that.
Yeah, so we do utilize, we can utilize Atlantis abutments. We work with pretty much all scan, implant platforms. And we do, custom. So if you're, using Straumann, we can do Straumann custom abutments. We can do Zimmer custom abutments, BioHorizon. So, but we also can do it Atlantis custom abutments as well.
And also, just to add to that, Dr. Mason, the scan body is going to determine the workflow. So if you use a BioHorizon or a Nobel scan body, that is what the lab is going to give you, are OEM parts of that particular implant platform. For us, our Lexier lab preferred implant is through Preet. So if you want a Preet scan body, just contact one of our labs, and that will determine the workflow for our kind of default, if you will, of our generic system through Preet. Those are autoclavable, they're metal, and you can use them more than once.
Great, thanks.
Yep.
Thanks, Eric.
Awesome. Sorry about the music, guys. I thought you could hear, so my apologies. I probably should have asked at the beginning. Awesome. So moving on into our Lexier scan quality evaluations. So this is something that we do here at Lexier. I do just want to highlight before I dive deep into each of these ratings. I do just want to highlight that this is only for crown and bridge scans and only for iTero scans at this time. We are looking to expand our quality evaluations to other platforms, but at this time, it is only on iTero scans. So if you're using another platform, I do apologize, but hopefully maybe in the near future, we'll be able to have these reports for you as well if you're on a different platform. But the way that we grade scans here at Lexier is we have 4 categories that we put them into once we receive them at the lab. And so starting off with a perfect scan. So what we deem as a perfect scan is visible margin is 100% clear around the tooth structure. There is no contamination or missing data on the prep. So as you just saw that scan, as you can see, I was really making sure I got all the data around my prep. All the margin line was visible. I could see it. It was clear. So that when I send it to the lab, there's no question about where my margin line is. Okay. Good scan. This falls into where, 30% of the visible margin is either covered with gingiva or contamination or has missing data on the prep. So it's, not quite perfect. Some parts of that margin we cannot see, so we bump it down into the good scan category. And we're going to show you guys some images and pictures of each of these categories so you can get an idea of what we look at and how we do it here at Lexier. Manageable scan. So the manageable scan is, we recommend that you rescan it, but we certainly will try to work with it. This is more than 30% of the visible margin is covered by gingiva, contamination, or missing data. So same kind of concept. It's just more of the margin is actually not visible when we drop it down to a manageable scan. Again, this is a rescan recommended. And if you say proceed, or if we have a question on the scan, we'll proceed with it. But certainly want to make sure we get everybody in a good and perfect category when it comes to their crown and bridge restorations. The last category here is the rescan required. So this is complete visible margin is covered, it's with gingiva or contamination, missing data. The lab does not recommend proceeding with restoration with this quality. We'll show you what some of those scans look like as well. And I think it will be very eye-opening that, some of these scans are actual scans that we have received here at Lexier. So we just pulled them out of our portals. And that way you can see what gets sent, what we see at our end on the lab, and hopefully it will help you understand the importance of checking your margins, checking your preps, making sure everything's clear, no missing data, things like that before you send it off to the lab. Awesome. So starting off with the perfect scan, obviously, as you guys can see on the left-hand side, this is the monochrome view versus color on the right-hand side. And you can see that we can see the visible margin all the way around, no issues here. We would say this is a perfect scan. Now, I do just want to highlight you guys may be looking at the actual preps itself too. We're just looking at the margin. So if you're looking at how the preps were prepped, we're not necessarily grading your preps. We're just looking to see, can we see your margins? So I do just want to highlight that as I'm going through these scans. Here's another perfect scan. So again, we can see the visible margin. I know obviously off to that distal there, we've got some blood and things going on over to the side, but we can still see that margin, no contamination. We would say this is a perfect scan. Moving on into a good scan. This is where we got about 30% of the visible margin covered. So as you can see, obviously, over onto that buccal side, we've got some tissue covering the margin. So obviously we've got to drop it down a category just because while we probably could still do a really good job with this restoration, it just bumps it down into a different category. Another good scan. Again, you've got some areas over down in the lingual side. Oops, thought I had more arrows there, but just some tissue covering that lingual side on this prep over here, but the other prep looks to be pretty good. So, and
One
Emily,
thing-
if you have any, I was going to say, perfect. If you have any comments, certainly hop in.
Yes, one thing I don't think we mentioned, you know, if you can look at in monochrome view, it does help obviously to see the margins much clearer. So I think when we train on that, that's something that we really try to emphasize is like check your margins in monochrome because you can see the margins. So just a little tip there to add.
Awesome. Thank you. Moving on into a manageable scan. So as you guys can see, there's a lot going on here. All my arrows pointing to areas where, you know, just all the way around, generally this probably this is why we say rescan recommended, but could we proceed with this? Yes. What is the outcome of this case? You know, unpredictable, but hopefully good. We'll do the best we certainly can, but you know, when we receive scans like this at the lab, obviously we do, you know, it almost becomes somewhat of a guessing game for us because we really have to try and make sure, you know, we do our best based off of what we receive. So you can see a lot going on in this scan, and this is why it's manageable, but rescan recommended. Here's another manageable scan. Again, as you can see, so honestly in this one, again, when you look at it in monochrome versus color, I mean, really the only visible part, you know, for the most part of this prep is over on the buccal side. Everything else is pretty much covered up by tissue. There's no contamination of blood here. It looks like they had that under control pretty well, but as far as visible margin, again, rescan recommended. And then getting on into the fun ones. So rescan required. As you guys can see, there's a lot of blood. This I wanted to highlight down here in the bottom. So when you look at it in monochrome, if it ever looks fuzzy or pixelated, that just means that obviously, as you can see in this one, it's all around the tooth. But the reason why I wanted to highlight this is because if you ever see that on your preps and your margins are pretty clear, that just means there's like some saliva or something like that that is distorting the image. So that's why it's also good to look at it in monochrome, because in color, I obviously can see what's going on there. But again, in monochrome, sometimes if this wasn't blood, if it was saliva, it's sometimes hard to see in color versus if you put it in monochrome. But this is a rescan required. Another rescan required. So this one, I think some obvious things happening here. To whoever asked the question as far as turning the wand on and off when you're scanning the prep, my guess is that this office, whatever they were doing, they were spending way too much time trying to capture that prep. They were capturing clean images, then getting dirty images, and they were just letting the images pile on top of each other. There probably could have been some other issues going on here as well, but this to me looks like it's an extremely distorted image, and something that they did with keeping the scanner on and just scanning as that patient's environment changed turned out to be distortion when it got to the lab. So this is a complete rescan required. We would not be able to proceed with this case. And I think we've got two more as far as the rescan required. Obviously, there's more rescan required to show you guys versus perfect and good. And this is all why we do education, so that we can really highlight, you know, the areas that will help, you know, and just make sure we get everybody in that good and perfect category. But another rescan required, as you guys can see, again, just a lot of distortion going on, unclear margins, you know, retraction, a bunch of different things happening in this image, but this is a complete rescan required. Awesome. Do we have any questions on the scans, Emily? Just so I can't see that on my end, but just want to make sure.
Yeah, I have not seen anything come through. We can give it a minute if anybody has questions they want to add in.
Perfect. Or does anybody want me to go back to an image? I know you guys can't answer, but if you did, just put it in the chat. We can go back. Yeah, awesome. Well, if not, we can certainly answer anything at the end. But just so you guys can understand how we can support, what do we do here at Lexier? You know, we can provide hands-on training. So if there's ever an office that wants hands-on training in their office, either one-on-one with a new staff member or somebody that may just need some additional support, we can certainly provide that, or just group office training. So as you can see in this picture, this is one of our iOS clinical specialists. She's in an office doing an office training. Most of our trainers, or all of our trainers, are certified in Itero. Some are certified in Trios, and then some of our trainers do have some experience with other platforms, but we really are more streamlined around the Itero. But if there's ever things that we can help provide, I know Emily's great with, I think you do have some experience with Prime Scan. I saw that some of the attendees today do have a Prime scanner. So if there's anything we can ever do to help, we're always willing to do so. Get you that support, answer your questions, help you with the digital workflows. We can do virtual trainings, whether it's webinar style, like this evening, or we can do just office, regional virtual trainings if that's what you guys prefer. Then we can also offer some group training events. So we've done events in like a happy hour style team meeting setting. If you guys ever do something like that with your staff, we can certainly try and be there to do some hands-on training. And then just regional trainings, meaning if there's, several offices in a region that would like training, we can try and get you guys all together and do more of a larger group setting. So just some things on how we can help. Obviously, we're a phone call away too, which will give you our contact information at the end of today. But I sometimes will do FaceTimes with offices. I did one last week where they, FaceTimed me. Now I can't always do that because that's more of an availability thing. But if you're ever in a pinch or you need to text or call Emma and we can certainly help you or answer any questions that you guys have. And Erica, I'm going to pass this one over to you to talk about our your dental lab subscription agreement.
Fantastic. So just so you all know, Dr. Mason had alluded to this at the beginning of the meeting, but we do have a placement program for you all with the Itero. So Joe Malzone and I had worked on this and legal counsel for several months to try to get this off the ground. So I'm happy and excited to finally share this with you. But Lexier and Select Dental Management do have what is known as our Dental Lab Subscription Agreement, or DLSA for our acronym, to place Itero scanners within your office. I probably could have spent the majority of this time for education on this particular specifics, parameters on how this works. So what I wanted to do was at least give you all the a little bit of information so that you know that we have this available for you. But then I would rather you all reach out to me directly so that I can set up some time with you to go through this in depth so that everybody is aware. But just to give you some high level tips about this and what this program offers. Basically, we've got the Itero Flex, or the Itero 5D Plus Flex, and it's based upon your lab spend with any one of our Lexier labs throughout a quarter. So it is based on a 3-month spend instead of a monthly spend. It is 3 months. We kind of true up at the end of the quarter. Some people will do more 1 month if they take vacation. We wanted to kind of give you flexibility and options around this. So as you see, the two programs that are offered, it's either $67.50 for the quarter as far as lab spend, which breaks down to $22.50 per month, or for the 5D Plus, it's $15,000 for the quarter, which breaks down to $5,000 monthly. And then once you meet that monthly minimum with us, you're free to send your lab services to wherever you'd like. These scanners are not locked. It does not mean that everything that you do has to be with a Lexier lab. certainly we would prefer that, but we want to give you all flexibility. We want to give you options, and we want you to be able to make those choices. So once you actually hit those numbers with us on a monthly basis, you're free to send your scans wherever you would like. So again, just wanted to kind of give you a high level view that we have this going on. We have this available. So if you are interested, I have my email address, my cell phone number is there. Please reach out to me directly, just so we can talk through this further, so I can give you all the details, things like that. And then I would love to have you try out the labs. We've got multiple labs throughout the East Coast, several of them up where most of the select dental offices are located. So we've got lots of opportunity for you all to try us out. And then if it's something that you want to move forward with, as I said, I just have to reach out to Select Corporate, and then we can get a scanner placed at no cost to Select and no cost to the office. But you do have to just hit those quarterly minimums of lab service with us. And then you're free to have a digital platform at your office, and moving forward, going digital versus traditional or PBS impressions. Definitely looks like there might be some questions that came up.
Yes.
Are we ready for Q&A now?
I think there's still a few more slides.
Okay.
Even fine.
Yeah, do we wanna just finish up and then we can answer any questions? I think I have just a couple more slides on how to connect and preferences, and then we've got our QR code for feedback. So
Perfect.
Okay.
Yeah,
Yeah.
that sounds great.
cool.
Perfect.
Thank you so much, Erica. And I
Absolutely.
certainly can help out with this too, but a lot of the communication has been running through Erica on the digital lab subscription agreement. So we're happy to help. And moving on to how to connect to Elixir Labs. So if you visit our website, which I do believe you guys will all get an email after this evening, and it will have all the links and things that we talked about today. So you can just easily access them. But if you go to our website, go to send a case. It is going to walk you through how to connect your iOS platform. So whether you have an iTero, I saw, like I said, some people have PrimeScan. I know that one's not specifically listed on here. So if you do have PrimeScan, my contact information will be at the end of this presentation, but as well, it will be in that email. Just let me know and I'll help you get connected. So super easy to do that. Then last but not least, I did want to just highlight our Lexir preferences. So we've now made it a lot easier for customers to fill out their preferences. It is online, but it just helps us get to know you better, get to know what you like, help the partnership, and just by keeping your preferences on file. So what I would just ask that if you are going to start to send cases, if you're not currently doing that already, and if you are sending cases, just make sure we do have your preferences on file. But you can go to our website as well. We have it linked. You just click on this proceed to client preferences forms, and it will take you to the form we need. It's digital. You fill that out, and we then keep it in your file here at the lab. So super important that we have that, and we encourage everyone to fill that out and get that sent back into the lab. And then finally, this is just, we'd love your feedback. So again, we can put this in the email when we send it out to you guys, but if you happen to just have your phone out, or if you're on your phone right now for the webinar, we certainly understand, but we'd love just your feedback on tonight's program, and then just some things we could partner on maybe that you're more interested in that we could cover at a later time. And then the last slide is just our contact information, which you guys will all get as well too at the end.
Thank you so much, Tori and Emily. That was fantastic. A ton of information.
Yes, a lot of information, but like I said, we're a phone call away. If anybody wants to follow up or email or schedule a training or meeting or anything we can help out with, we're happy to help. But it does, I can now see the questions, so I don't know if we want to open that up.
Yeah, there was one question, how do I obtain a fee schedule? I assume that would be Erica, but if you want to, yeah.
Yes, if you can, all I need is an email address. If you want to text me an email address or send it to Dr. Mason or Dr. Portnoff.
I can forward that. I can forward it to Dr.
Yeah.
Wagner.
Okay.
I
I
have
say,
it as
I'm happy to send it to Dr. Portnoff, who can send it out to everybody. Yes, we want you to have the fee schedule for anybody to take a look. There is a traditional
Yeah.
and digital. So if you go digital, it actually benefits you a little bit on the price as well. And then it has the turn times and some of the other specifics. So happy to share that through Dr. Portnoff.
And if you do have a question, if it's easier, we can open it up. If you want to just raise your hand, we can open it up to, questions if you guys wanted to hop on. We are a smaller group. Sometimes we just keep it this way, so it's not bombarded, but feel free to raise your hand if you want to hop on and just ask a question live and in person.
Dr. Portnoff, I think I did see your question.
I was just gonna say that.
Yes, and I want to make sure that I address that. So our grading system is something that I don't know who all is using our case portal management system, which is MyLab Connect. It is obviously free for you guys to use. It's a great way to track cases, chat with the lab. There's an online chat feature. You can look at what's in production, request labels, things like that if you need to. But there is a section in MyLab Connect where you can go and click on, your scan gradings, and it will give you basically like a report card of your gradings that you sent to the lab that month. Now, again, it is strictly iTero scan. So if you're sending from another platform, you unfortunately won't be able to get that from us at this time. But we can also too, if there's ever anybody that wants to know, and maybe they're not on MyLab Connect platform, which I do highly encourage everybody to be on. But if they're not, we can certainly pull those on our end too. And I can share that and pull it on any of the scans that were sent into the lab. As far as receiving feedback from the lab directly, so if we ever have to send a scan back, so if it's a rescan required, we're going to push it back to the scanner, especially if it's iTero, and then we're going to call. We're going to call and let everybody know, or speak to someone in the office and let them know why we're pushing the scan back and why we need the rescan.
Looks like we've addressed all the questions. As Tori mentioned, I will be sending out a follow-up email with a lot of the documents that she referenced and some links and just some additional information. And again, everyone's contact information. And then lastly, we do really value your feedback in terms of the education and content that we are bringing. So, please just take a couple minutes and give us your feedback, maybe other types of programs you'd like to see from us in the future. We really have a whole library of different programs that we can offer here at the lab. So we'd love to kind of have a better sense of what you guys are looking for and being able to provide that.
Absolutely.
I think that wraps it up. I don't know, Dr. Mason, if you have any closing remarks or.
No, thank you guys very much. It's really important, some of the stuff we're seeing, making sure that everything is, the lab's getting good cases. That's how we get good results and good crowns and happy patients. So
That's right.
no, thank you very much. I think it's really important that we have a really strong lab partner that is able to give us the feedback, that we're doing within our offices. And it's easy, it's digital, it's quick snapshot of what went wrong, what wasn't right, what we can improve upon. So thank you guys. Thank you all very much.
Absolutely.
Thanks so much for having us.
Thanks,
Excellent. Thanks, everyone.
Portnoff.
Okay.
Thanks, everyone. Thank you for
Guys.
joining.
Have a good evening.
Everyone.
Have a great night.
Night.